Hey everybody, I get a lot of questions about why patients' quads still hurt after knee replacement surgery. So people will ask me, why the heck does my quad hurt so much? I had my knee replacement. Is this part of the surgery? Is this something else? Like what's going on? So quick little rundown of why it hurts so much. So let's talk a little anatomy. So we have our quad muscle, which is actually made up of four muscles. That's why it's quad, four, quad. So that is at the front of your thigh from your hip down past your knee. Your quad muscles come together, form a tendon together, the patellar tendon, also known as the quad tendon. Your kneecap, your patella, sits inside that tendon to make your quad muscle more efficient so that it can pull appropriately efficiently to make it really strong. So why do you have quad pain after your knee replacement surgery? So part of it is just the surgery itself. So in order to get to your knee, what the surgeons sometimes do is they actually pull your kneecap out of the way and hold it there during the length of your surgery. So 1, 2, however many hours it is for your knee replacement, depending on what your surgeon has to do and past medical history and everything like that. So it's pulled off to the side, stretching that quad muscle. Quad doesn't like it for that amount of time. So that's part of why your quad hurts. What is another reason why your quad hurts so much after knee replacement? Well, think about how much movement you were or weren't doing before that surgery. So it got tight, then it got stretched out in surgery, and now you're doing exercise and walking around more. So before surgery, you're probably walking around with a limp. Maybe you weren't walking around as much as you wanted to be or needed to be because your knee hurt so much. Now you're using it more. So you have to move around and stretch it out and work it. And it's not used to doing that. And if you were walking with a limp before, your quad wasn't working the way it was supposed to be working. Another reason that your quad hurts so much from knee replacement surgery is just the surgery itself. The surgeon is moving and bending and straightening your knee to crazy amounts to check to see that everything's in place and everything is lined up correctly. So those are reasons why your quad is so painful after surgery. Some things that you can do to help it are some ice, stretching, strengthening, increasing circulation, and then some pain relieving creams. So ice, calm down some inflammation, calm down that pain, numb it up. 20 minutes at a time, every day. I usually tell people in the first couple of days to 2 weeks after surgery, do it every hour for 20 minutes. Every hour you're awake. Stretching, you want to stretch out that muscle. You have a tight muscle, you have a tight knee, it's probably a little swollen. Stretch it out, that will help. Then strengthening, it's been weak. Now you're trying to use it more, trying to exercise it. Strengthening it will help calm down some of that pain to make it work the way it's supposed to. Increase circulation, walk around a bit. I tell people every hour you're awake after that knee replacement surgery for the first 2 to 3 weeks, walk for 3 to 5 minutes at a time. So that's probably getting up from the couch and going to the bathroom or going to the kitchen, get a glass of water. And then the next hour you have to go to the bathroom because you got that glass of water. Just move around a little bit. And then finally, pain relieving creams. You can use whatever over the counter stuff they sell. You may have seen, I've done videos before comparing 3 different kinds of cream. My favorite is the doTERRA Deep Blue. That one really helps my patients. Rub it into the muscle. Don't rub it on the incision if you still have an open incision or staples, but you can rub it around the knee, rub it on the quad muscle, get things to feel better.